This is a very important milestone in the delivery of the government's Living Longer, Living Better reforms, a $3.7 billion package. And this particular element of our reforms addresses something that was identified by the Productivity Commission, by the aged care sector and by consumer groups as perhaps the most important challenge we have in having a good quality, sustainable aged care system for the future. Today I'm announcing $1.2 billion that will be made available to aged care providers who are willing to sign up to the terms of this Aged Care Workforce Compact, a compact that has been worked on now for several months by aged care employers and aged care unions working under the auspices of the Fair Work Commission. There are currently around 350,000 workers in the aged care sector, and over coming decades we're going to need to increase that workforce to almost 1 million workers, to the point where 1 in 20 workers in Australia will be an aged care worker. But already, even with 350,000 number, we know we are experiencing very significant skills shortages, trouble recruiting and retaining the workers that we need. Our recent workforce census showed that more than 60% of residential care facilities say they have trouble getting registered nurses that they need, and 50% are saying they have a shortage of care workers. Now, the Productivity Commission told us that we should make sure that aged care funding is directed in a way that would underpin fair and competitive wages for aged care staff. They said that wages was the major hurdle to us being able to attract and keep the aged care workforce we need. After the Productivity Commission report was released, the National Aged Care Alliance, a group of aged care providers, consumer groups like COTA, aged care unions and clinicians, gave to the government a blueprint for reform, which included a clear statement that they wanted a wages supplement paid to aged care providers to help improve wages in the sector, and that they wanted that wages supplement paid in a way that was tied up in registered industrial or enterprise agreements, a blueprint that was signed up to by the major provider peak organisations and the larger providers including Catholic Health Australia. So today we are announcing the final arrangements delivering on that commitment by the government made last year, reflected in the advice from the Productivity Commission and the request from the National Aged Care Alliance. In order to qualify for this money, aged care providers will have to pay a minimum level of wages to their care staff, to ancillary workers and to their nurses, wages that will be above the minimum award rates currently set as a legal minimum. They will also have to pay minimum annual increases to ensure that wages continue to rise in real terms in this sector. Over the course of the 4 years of this agreement, personal care workers who are currently on minimum award rates will receive wage increases of around almost 20% over those 4 years, enrolled nurses 25% and registered nurses almost 30%. This will go a long way to improving the capacity of the aged care sector to attract and, importantly, to retain the quality, dedicated aged care workers that we need. Now, in my experience, can I say just in closing, aged care workers don't tend to work in the aged care sector for the money. They do it because they love the work. But that in itself has to stop being an excuse for paying such low wages for such important work. This is an incredibly central part of our vision for an aged care sector of the future that supports and rewards the hard work over so many decades of our many hundreds of thousands of older Australians. And I'm very grateful for the work that aged care providers and aged care unions have done in putting together the terms of this compact. It will make a very real difference. Now, I might just throw to some other people who've got a few things to say about this.
I'm so eternally grateful to Mark for listening to the voices of the aged care workers. This is so long overdue, and I'm so glad I'm speaking on behalf of all the aged care workforce and also our poor elderly who's got no voice. So good on you, Mark.
I'm just overwhelmed. I love my job, but we need to be paid for the skills that we have so we can look after the aged. Okay. Thank you.
Therefore, for the first time ever, a federal government has dedicated money to aged care workers and has tied it to enterprise bargaining so that we are assured that nurses, assistants in nursing and ancillary workers can get money, can get increased wages. They are amongst the lowest paid in our communities and they do some of the most important work. It's a fantastic day. Congratulations to the Gillard government and to Minister Butler.
Thank you, guys.
Well, this compact provides money when we're bargaining for employers to add an additional 1% on top of the required minimum of 2.75% pay increases per year. So this will improve the outcomes for aged care nurses. It doesn't close completely the gap that we've had developed between public and aged care sectors, but it will go a long way in improving the outcomes for our members in aged care, and the fact that it is tied to enterprise bargaining is the only way that we can be assured Commonwealth money will flow through to the wages of our members.
It's going to make a big difference to all the nurses that work and look after our elderly, because then there'll be more nurses coming in. There'll be so the staffing will increase, and there'll be better care for our elderly. Because as much as we want to care for our elderly, there's not enough time because there's not enough staff. We're spread out so thinly. So by doing this, we're going to attract more nurses in the workforce. So it's really going to make a big difference.